It's a great pleasure for me to talk to you, Dee, today. Could you please introduce yourself and what do you do for business?
My name is Dee Whitelocke. I'm the owner of the company Pro Initiative Billing. We bill for medical providers, hospitals, all specialties, cardiology, endocrinology, pediatric. We've been in business for about a year, but I've been doing this for over 15.
Why did you choose this line of business?
Well, I first started out when I was a teenager, and I just clicked in as far as catching on to it. I just had a niche for it. So I decided to go to school and a lot of it is self-taught and experience, but it's been a major part of my income.
Yeah,
It's
that's
also
so.
something that's never going to die. People are always going to want, people are always going to need medical care, and they need people to make sure that the insurance companies are paying the providers the way they should be paid.
So this tells me that you have done your homework very well before you chose your line of business.
Yes.
Well, what exactly did you do to choose this line or to choose this industry?
Well, you froze a little bit. Like I said, I started when I was a teenager. The reason why I went into it is because my mom is a nurse, and she's the one that kind of geared me towards that. She said I should go to school and try to get my feet wet into the medical field. I started working as a pharmacy tech first, and then I wanted to get paid a little bit more, so I decided to learn more about the business. And so I started working with a chiropractor, and he actually had me running his whole office. So I was the office manager. I did the billing for him, and then from there, I went with an endocrinologist, and that's when I knew I kind of wanted to stay in the medical field.
Oh yeah, that's so inspirational. What is medical billing?
So basically, doctors need they need for their services to be paid. So when they see a patient, they have to have a means of communicating with the insurance company. And in medical billing, we have codes to specify the things that they do, and we have diagnosis codes, and that's how the doctors get paid, is off of those codes.
Well, okay, can you explain what do you mean by a code?
So an office visit, we can't send out a claim just saying office visit. There has to be a specific numerical code that indicates that it's an office visit. So that's basically the easiest way of explaining it, is that it has to be a number that specifies the type of service that the doctor performs.
Yeah, I understand. What is an outsourced revenue cycle management, RCM?
Okay, so that's basically the process where you use medical billing software. We use that to help track um, payments, or sometimes patient information, the appointment scheduling. So basically that's the revenue cycle management process.
What kind of information do you usually keep about your patients?
Um, we have like the basic information, name, address, date of birth. Sometimes social, it's not really a requirement now that there's been so much identity theft. But we have their insurance information. We have, yeah, basically their insurance information, which consists of the ID, the identification number, and the guarantor. So whoever holds the insurance policy, we have that on file as well. Depending on the type of practice, we would have their medical records as well in a system called EMR. It's electrical medical records. Um, but when you're doing outsourced billing, most of the time you don't really have that we sometimes have the because we have to show why the necessity of why the doctor saw the patient. So sometimes we have some medical records, but since we're an outsourced company, meaning it's not in the office, the records are mostly at the primary office location. We don't have that.
Oh, yeah. Okay, could you like give me an explanation of how your business is done on the ground? Like, do you visit the patient physically? Do you visit the doctors? How do you link this circle together?
Everything is all done online. So if we need to do a meeting, especially if they are local, then if it requires a visit, an initial visit, then we'll go and we'll visit the office. But overall, it's done online. Everything is transmitted. So they would send over the claims electronically, and everything gets done that way. If they need to send records, it gets scanned and then transmitted to our program, and that's how we communicate. Emails, secure emails.
Mhm. Let me ask you another question here. Like, um, do doctors need your help?
Sometimes they do. Sometimes they'll ask, what is the best code for this, or I spent this much time, can I get paid on this? And but overall, the communication with the doctors are minimal. We usually speak with just the office manager or the billing manager for that practice.
Mhm. What is a statement that is sent to the patient? How do you recommend the patient to take further action?
Okay, well, the statement is our service is billed to the patient. The patient doesn't receive a bill or statement until the insurance company has paid their portion. So if the patient has a dispute, we go over the details and then we direct them to the insurance company. That's the last resort. If they aren't happy with what we tell them, then we refer them to the insurance company to dispute it with them.
What can the insurance company do in this case?
Well, the insurance company can explain to them if they're disputing their responsibility. If they got a bill for $150 and they're saying they don't understand why, and we're telling them this, it's because you have a deductible, or it's because you have co-insurance. If they don't take our word for it, then we say, okay, call your insurance company and you can verify with them if you do have a deductible, and then you can find out when your deductible will be met.
Mhm. Like they are debating to get a reduction or something, like reducing
Right.
fees.
Right.
Ah,
But
yeah.
overall,
Mhm.
deductibles are illegal we cannot waive deductibles. So,
Why not? Why not?
because it's like, okay, well, if you have a contract, basically the doctors have a contract with the insurance companies. They agree to accept whatever the insurance company is paying them. So long and short of it, a deductible is basically, if a patient didn't have a deductible, then that's what the insurance company would be paying. Let's say they came in for an office visit and they got the insurance would pay $150. That's what we would accept. So if the patient has a deductible of $150 and we reduce that, that's a breach of our contract because we're not accepting what we say that we're accepting. And if we go ahead and reduce things, then that means that we're willing to get a reduction from the insurance company as well, which kind of screws us over.
Ah, yeah, yeah. Okay, good. How do you find the skilled staff like yourself? And what skills do you need in this business?
Well, you need to have a common knowledge of medical billing and coding. And we look right now, our everything is family owned, so we have not sought out any outside help. But when we do need more help, we're going to be looking for people with certification, common knowledge of medical billing and coding of at least 3 years. and they have to have phone etiquette. And they have to be able to review patient statements and understand the insurance lingo.
Oh yeah, I think I can do that easily. What kind of system do you use? What kind of
We
system
use
do you use?
we
Yeah.
use ClaimMD. So ClaimMD is basically, it has everything. It's able to generate reports for us. It generates patient statements, and it also we also bill directly from there too. So we get the procedures, and then we bill it out to the insurance company, and then we receive information from the insurance company through that program as well.
So now you mentioned encoding and you mentioned the system. Like, what kind of college or what kind of university should a person study to be able to qualify for your job?
Well,
Like, excuse me, like, for example, should I be a programmer, like someone who is computer savvy, technology savvy, or something?
yeah, I mean, we typically want you to at least have a high school diploma, because a lot of these programs that are offered, you don't need to go to you don't need a 4-year degree, but you do need certification. In order to get a certification, you need to have a high school diploma. So we require that at least. And if we feel that you're strong, but you just need credentials behind you, then we would definitely hook you up with getting your certification, so that you can get a little bit more knowledge.
Yeah, let me ask you another question here. Like, how stable and how comfortable is your job? Like, if I come and I join your company, how secure is my job?
Your job is secure as long as you have the skills that we need, because it's a business, right? So we have to make sure that all of the employees have something to offer to the business and want longevity in the business. And it's also a job that's remote. You could do it from home. So pretty secure as long as you have an idea of what you're doing and you're willing to keep up with your education.
Yeah, like, okay, let me ask you a difficult question here. Like, if I am a family man and I have a family, a wife, and some children, so do you recommend me to join your company?
Yeah, I mean, if you have an interest in medical billing and you have like some sort of if you as long as there's an interest, then it would be a good career choice, because like I said, in the medical field, there's always going to be a need for us, for billers, so it would definitely be something I recommend. And it's not as time consuming as other jobs, as to where you need to go to school for 6 years to not be guaranteed a job. You know what I mean?
Yeah. Okay, very nice. What kind of other companies are you associated with, or do you usually work with?
Like I said, just the insurance companies like Aetna, um, United Health
Mhm.
Care. Can you hear me?
Yeah, I can hear you. Go ahead.
Froze a little bit.
Yeah, it's okay.
Okay.
So we have been
What's the
speaking
last thing
about,
you heard?
yeah, we have been speaking about the other companies that you work with.
Okay. Yeah. And like I said, private practices with endocrinologists, pediatricians.
Okay. What federal and state health services rules do you have to comply with?
So we have to ensure that we're HIPAA compliant, and HIPAA is basically like a privacy of patient information. And in addition to that, we have to follow CMS guidelines, because they're pretty much the ones that determine how claims get paid. CMS stands for Centers for Medicare and Medicaid Services.
Oh yeah. What is practice management?
So the person who manages the finance and administration of a doctor's office or an office of a medical professional is basically in charge of the practice. So they're basically managing how doctors communicate with the staff as well as the patients. They make sure that functionality is up to date, make sure that we are following rules, you know, there's no fraud happening.
Very nice. What is coding and compliance?
So an office or individual has set up a program to run the practice according to the regulations set forth by the United States Office of Inspector General. So basically there's always somebody above someone. So they basically, you have to make sure that you, like I said before, there's no fraud happening, making sure that the doctors are spending the time with the patients, the amount of time that they say that they spend with the patients. We have to follow the regulation, make sure that they really are, and not performing procedures that are unnecessary. That's like following guidelines.
Yeah, very nice. What is patient collection?
That's basically just outstanding balances on the patient's account. So whenever, you know, after 30 days is usually when companies like me start either making a phone call or sending out a letter. So after 30 days, if there's no payments, that's usually what we do. It's a collection report that we take care of.
And what is, like, could you explain more about HIPAA compliance?
So it stands for the Health Insurance Portability and Accountability Act. So it sets the standard for sensitive patient data protection. Companies that deal with protected health information must have like physical network and process security measures in place to ensure that this is compliant. So that to ensure that it's being followed. So basically, you wouldn't want us to release your social security number to, you know,
Yeah.
the dark net, you know. So so basically that's HIPAA.
Oh yeah, okay. Why are accuracy and the confidentiality important?
Well, if we're not careful with patient information, and if we're not accurate, then we could be losing money. So that's why we want to make sure that we bill correctly, you know, we're as accurate as possible. The more accurate we are, then we can keep on top of things. So when the Inspector General comes and he reviews our records, he'll see that we're following everything. And also, if things aren't done correctly, then we build a bad reputation, and then our business isn't going to thrive.
Okay, so throughout your experience and like field experience, what have you learned about your customers, about the people in general, about yourself?
That most people, they want more than what they pay for. But if you show the value in what you're offering, then people are willing to pay. If they see that they are getting results by employing you or using your company, then they'll refer people, and you know, it might be a little bit pricey, but it's worth it, you know.
Oh yeah. Okay, it has been a great pleasure talking to you today. Dee, thank
You
you so
too.
much.
Thank you.